The operating room had gone unnaturally quiet. Machines continued to beep, nurses rushed from one side to the other, and the chief surgeon stared at the blood-soaked uniform of Colonel Nathan Brooks before quietly admitting there was almost no hope left. After hours of desperate effort, the medical team believed the decorated Army officer had only 5 minutes to live. Outside the room, anxious staff lowered their heads, convinced they were about to witness the end of a man who had survived countless missions only to lose his final battle in a hospital. Yet no one noticed the elderly janitor standing silently in the hallway, gripping his worn cleaning cart with trembling hands, carrying a secret that would soon change everything. Before we continue, if you believe kindness, second chances, and unexpected heroes still exist in this world, please take a moment to like this video, leave a comment, share it with someone you care about, and subscribe to the channel. Your support helps bring more inspiring stories like this to people everywhere. The story unfolded in a military hospital in Colorado, where Colonel Nathan Brooks had been airlifted after a devastating training accident involving heavy equipment. He had dedicated over 25 years of his life to serving his country, earning the respect of everyone who knew him. Friends described him as fearless but humble, the kind of leader who always walked beside his soldiers instead of behind them. Despite his strength, the accident had left him with severe internal injuries that pushed even the most experienced surgeons beyond their limits. Dr. Samuel Carter, the hospital's lead trauma surgeon, had exhausted every possible option. Every passing minute brought more complications, and the atmosphere inside the hospital grew heavier with despair. Among the staff was 72-year-old Walter Hayes, a janitor who had quietly worked in the hospital for almost 15 years. Most people barely noticed him as he swept floors before sunrise, emptied trash bins, and polished hallways until they reflected the ceiling lights. He greeted everyone with a warm smile, remembered birthdays, and often stayed late simply because he believed no patient should wake up to a dirty room. Few people knew that long before becoming a janitor, Walter had been one of the nation's most respected cardiovascular surgical assistants. Decades earlier, he had worked alongside pioneering surgeons across the United States before tragedy changed his life forever. Years ago, Walter had lost his wife, Rebecca, to cancer. Grief overwhelmed him so deeply that he walked away from the operating room, believing he no longer possessed the emotional strength to continue saving lives while carrying such unbearable pain. Instead of retiring completely, he chose a quieter role inside the same world he still loved. Cleaning hospital floors allowed him to remain close to medicine without reopening the wounds in his heart. He never spoke about his past because he believed titles meant little compared to simple acts of service. That afternoon, while pushing his cart past the operating suite, Walter overheard Dr. Carter explaining that Colonel Brooks had only minutes remaining. Something inside him refused to accept that the battle was over. His years of experience had taught him to recognize a rare surgical complication from the scattered medical details he accidentally overheard. His heart pounded as memories he had buried for decades suddenly returned with remarkable clarity. Every instinct told him there was still one final possibility. Walter respectfully approached the surgical team. At first, exhausted doctors barely acknowledged the elderly janitor standing near the doorway. His uniform, rubber gloves, and mop made him invisible in their eyes. But Walter calmly introduced himself and quietly explained his surgical background. Skepticism filled the room until one senior nurse suddenly remembered hearing older physicians mention Walter Hayes years earlier. Hospital records quickly confirmed his extraordinary career, leaving everyone stunned. Time was disappearing, yet hope unexpectedly flickered once again. With permission from the chief surgeon, Walter carefully described an alternative approach that had once saved patients suffering nearly identical injuries. His voice remained calm despite the overwhelming pressure. He guided the surgical team step by step, never demanding attention or credit. Dr. Carter immediately recognized the brilliance of the forgotten technique. The operating room came alive again as every member of the team focused with renewed determination. What moments earlier had felt like a farewell transformed into one final chance at life. The procedure was delicate and risky, but slowly the monitors began displaying encouraging signs. Blood pressure stabilized. The dangerous bleeding finally slowed. Every person inside the room held their breath as Colonel Brooks's heartbeat grew stronger with each passing minute. Relief spread across tired faces that had nearly surrendered to hopelessness. Several nurses quietly wiped away tears they had been trying so hard to hide. Walter simply stepped back into the corner, grateful that knowledge he thought would never matter again had found purpose at exactly the right moment. Recovery was slow, filled with painful rehabilitation and months of determination. Colonel Brooks fought through every challenge with the same courage that had defined his military career. When he finally learned the truth about the elderly janitor whose wisdom had helped save his life, he insisted on meeting him. The meeting became one of the most emotional moments the hospital had ever witnessed. Nathan embraced Walter with deep gratitude, recognizing that true heroes often wear ordinary uniforms and quietly serve others without expecting recognition. Hospital administrators honored Walter's remarkable past, but the humble janitor accepted every compliment with gentle humility, reminding everyone that compassion and experience never lose their value simply because time passes. As news of the incredible story spread throughout the community, countless people began looking differently at those whose jobs often go unnoticed. Nurses thanked custodians more often. Doctors listened more carefully to every member of the hospital staff. Patients smiled at workers they once walked past without a second glance. Walter's simple act had done more than save one man's life. It reminded an entire hospital that dignity belongs to every person, regardless of the uniform they wear. Before we reach the end of this story, we'd love to hear from you. Please leave a comment with the words, "Every person matters." Your message may inspire someone who needs hope today. Colonel Brooks eventually returned to public life, carrying not only the scars of survival but also a deeper appreciation for the quiet heroes surrounding us every day. Walter continued pushing his familiar cleaning cart through the same hallways, never asking for applause and never changing the gentle smile that greeted every patient. The greatest miracle was not only that a wounded colonel survived against impossible odds. It was that one forgotten man proved that kindness, humility, and lifelong dedication can become the difference between despair and hope when the world needs them most. If this story touched your heart and reminded you that true heroes can be found in the most unexpected places, please like this video, share it with your family and friends, leave your thoughts in the comments, and subscribe for more emotional stories that celebrate compassion, courage, and the extraordinary goodness hidden within ordinary people.